Are you embarrassed by your big bloated stomach? And are you tired and sometimes embarrassed by all that excessive gas and belching that you have when you're out in public? Hi, I'm Dr. Wanda Bettinghouse, a functional medicine doctor. Well, in conventional medicine, when you go to your doctor, you may find that they're quickly rushing to either schedule you for an endoscopy or a colonoscopy to try and explain why you are having this problem of a bloated abdomen. Now, while those procedures may give us valuable information, they're really not getting at the functional level, at the cell level of what is going on that is causing this excessive production of gas. You know, just taking an antacid or a gas blocker is not really going to solve the problem. What about looking at the gut bacteria? How often does a doctor actually analyze the microbiome, looking for a balance of good bacteria and an abundance of good bacteria in the gut? It's probably not very often that your doctor does that. You know, what I have discovered over the years that when I was in medical school, I'm not sure that I even knew the word microbiome. And we have learned so much more about that important part of our inner physiology. As one doctor back in the 1800s said, all disease starts in the gut. And that got my attention. And that's really one of the reasons that I decided to study and practice functional medicine. You see, in functional medicine, we're looking at the whole person. So we have to examine every part of the physiology. And over the years that I've been studying functional medicine, I think I finally agree with that doctor back in the 1800s that said all disease starts in the gut. You see, it makes sense, doesn't it, that the gut is the gateway to the whole biological systems. And if there's inflammation there, it can actually lead to conditions called leaky gut that can also then precipitate the tendency to develop food allergies, food sensitivities, autoimmune disease, and even brain fog. And we'll talk more about brain fog later. You know, there are many causes of abdominal bloating, but what it is ultimately telling us is that your digestion is not good. You're not properly digesting your foods. If you're not digesting your foods, then it's going to lead to excessive gas, fermentation. And that excessive gas is what's causing that big belly, all right, which is most uncomfortable and sometimes actually embarrassing when you go out in public. In functional medicine, when I see a new patient, the first thing I do is to evaluate their whole history, do a physical examination, and then often order tests that are going to give me some idea about the health of the GI system. One of the first things that I recommend for my patients is to begin an elimination food plan, because it's kind of the simplest test to do and it's relatively free. It requires a little commitment to eliminate certain foods that we know cause problems. You see, healing really can take place. And what I love about what I do is that I develop a partnership with you so that we can explore all the different ways that we can help you heal in a more natural and holistic way. And frequently it's going to involve your GI tract and the kind of foods that you are eating. Now, if you want to go deeper on this subject of abdominal bloating and other GI issues, you'll want to register for my free video series on the importance of a healthy gut. Simply click on the link below this video. And if you really want to go even deeper and understand even more about gut health, you will want to sign up for a free discovery call with me so that we can explore your specific symptoms. Simply click on the link below this video.